Welcome back to the Means Report. Dr. Vaughn McCall, Chair of Psychiatry at MCG, is our special guest, talking about mental illness, talking about suicide. And before we went to the break, Dr. McCall, you were telling us about veterans and how environmental circumstances like war and other things that they see can take a hardy person and turn them into someone who is, in fact, suffering from a mental illness. Can we get these people on medication when they get back from war zones to try to kind of preempt the illness, since we know it could be coming, or do you have to wait for symptoms to present? Sometimes it's too late when they do.
Right. That's a fantastic question, and the hopeful answer is yes. There's some things that can be done right behind the front lines that make a difference, and so debriefing of a warrior who has been traumatized by relentless bombardment, or seeing a comrade seriously injured, and this can lead, of course, to an acute stress reaction, but debriefing that person and having a counselor who does not necessarily have to be a doctoral level counselor can maybe reduce the risk of chronic post-traumatic stress months and years later. There's also some experimental evidence that trying to dampen the fight or flight response which occurs right after a traumatic event, if you can quell that, that might reduce the risk of developing post-traumatic stress months and years later. And so the Department of Defense is well aware of this and actually has professionals working close to the front lines in many cases to provide that level of counseling and service to our warriors who have been in a traumatic circumstance.
Whether you're talking about a warrior or whether you're talking about a fashion icon, a gifted lady like Kate Spade, there's a stigma associated with mental illness. For her, probably, she didn't want to talk about it because it could hurt her business. For the warrior, it makes them seem weak.
Right.
Are you seeing that stigma subside as months and years go by? And if not, how do you fight it or address it?
The stigma still exists, but it is getting a little better. Mm-hmm. And it sort of depends upon the specific mental illness. I would say that depressive illnesses, maybe even some bipolar illnesses, people are somewhat more willing to speak about publicly and share their experiences, or perhaps encourage others to seek help. I'm not sure I've seen the same degree of openness pertaining, for example, to schizophrenia, and maybe not for post-traumatic stress disorder, which, as you were saying, Brad, you're exactly right. Servicemen and women who are devoted to their jobs often don't want to be taken offline. Mm-hmm. And if you disclose too much about yourself, of course, they fear that they may be taken off duty or given responsibilities they'd rather not have. And so we have to sort of split the difference and walk the fine line to make sure that people get the help that they need without feeling like they're necessarily disenfranchising themselves from the sort of life that they want to have.
Do you see a lot of children come through your office, and what's making them sick?
Well, fortunately for the children, they're seen by experts in my department and elsewhere throughout Augusta. My child psychiatry colleagues, and hopefully they're watching this tonight, would be quick to say that children do need, when possible, a slightly different approach, and that someone who is specially qualified in treating children with mental illnesses should be the ones delivering that care. Now, with that said, I have to share with you that there is, in general, a shortage of psychiatrists in the United States, including a fairly terrific shortage in the Augusta area. We would like to have more help. And there are circumstances where an adult-trained psychiatrist like myself may feel compelled to provide care for a child.
How can we tell? Withdrawal from their peer groups, doing poorly in school, kind of a younger version of what you described as adult symptoms?
Right. I would say poor school performance, especially if there's an obvious drop in school performance, social withdrawal, self-neglect, and so not bathing and putting on fresh clothes at the same frequency that you would normally expect that particular child to do. Perhaps obsessive immersion in social media to the exclusion of live and in-person human relationships. These are all signs of concern.
Every child is mentally ill then?
Well, we worry about the degree of social media.
We do.
That needs to be kept in measure.
Let me ask you about how peers can possibly spot it and what the appropriate recourse for them is, if that's the right way to put it. What signs could I see in my buddy if I'm a child, a teenager, that makes me think something might be wrong with him?
So if your buddy suddenly shows signs of being disconnected, that someone that you previously had a warm relationship where conversation was easy and they would be quickly responding in the event that you did use social media to contact them, and now they're not responding, or if they're not interested in spending quality time with you, or if postings on social media became quite dark.
Great point.
And it's strangely, people who are contemplating suicide don't always keep it a secret. Sometimes it's really out there in the open for everyone to see. And when there is a public pronouncement or posting about suicidal intent or something that can be inferred to be suicidal, then it needs to be called upon. I mean, you need to, rather than ignore that, it's just ask the hard question as a friend and say, I've noticed this, what can I do to help, or can we talk about this?
Are there certain mental illnesses that you can cure?
Well, there are certain mental illnesses that we know that we can bring into remission, meaning that the symptoms of which become virtually invisible, and patients can lead full, healthy lives. I can say that with confidence. A different matter is whether we can cure them like an antibiotic cures an infection. So to use that analogy, if someone had a pneumonia and was given an antibiotic, then after the course of therapy, the antibiotic is removed, the pneumonia is gone, and it may not come back. Are there instances in psychiatry where a mental problem can have a single course of intervention, produce what appears to be a cure, the intervention is then removed, and the cure persists? I think there are a handful. And so examples include simple things like specific fears and phobias, which might seem trivial in comparison to something like schizophrenia, but for a person who's afraid of flying and is a businessman or businesswoman,
dominate your life.
It can be a real problem. So this is an example, maybe a simple example, of where you can actually affect cures, which can be lifelong cures, and then remove the treatment and the cure persists.
Well, that's certainly encouraging. Probably my last question, it's just how do you pay for it? Some people have insurance. They have an easy route to better health. Some people do not. What's out there that can help folks whether or not they can afford it?
Well, there's good news about this, especially in the CSRA, and that is our state governments do provide funding to local mental health agencies, which are handpicked to provide care to everyone. And so within the Augusta area in particular, we have two large providers of mental health services that will provide care at little or no cost if someone has no means or little means to pay. I'm sure, I'm less familiar with the South Carolina side of our viewing area, but I'm sure the same exists there. In the Augusta area, Serenity and American Work are probably the two largest providers that have some degree of public support to provide help for those that need mental health treatment and have no or little means to pay. But there are other smaller providers as well, including those that provide essentially free care or nearly free care for substance abuse and addictions.
Listen, I cannot thank you enough for the information. I've learned a ton from you. I certainly believe that our viewers have as well. And much of what you said is encouraging because there is help available.
Thank you, Brad, for having me.
Absolutely. Dr. Vaughn McCall, chair of MCG's Department of Psychiatry. He and his team do a wonderful job. By the way, if you want to be a child psychiatrist, there are openings out there.
Please contact us.
Please keep studying and contact them if you need help as well. We have resources that are out there for you. We will show you those on the television screen so that you can get the help you need. Just a phone call away, 24/7. Make it before you leave the light, as we talked about at the top of this broadcast. We'll be right back.